So thank you everyone for coming here this evening. I know many of you make a great effort to be here, so thank you very much. I appreciate that. We're going to get started here. The introductions, myself is Deb Angus. I'm the person who started up this group, and my cohort is Josephine. She's not here today. She's been dealing with a cold, so she does apologize, but says hi to everybody. I'm a traumatic brain injury warrior, author, speaker, and advocate. I used to work at the University of Calgary as an admin and research assistant for 30 years, and that's how I found out. And my book is not here either, it's down in the car. And this is how I had the skills to be able to research this and figure out through the literature, and I researched for 10 years while I was recovering. That's how I found out all this information about people who are dealing with multiple concussions like I was. And I was diagnosed with a traumatic brain injury as a result of multiple concussions. And when I started this, I said families need to know about this, and that was my driving force, because we were living with this for 11 years prior. My husband was hit by a drunk driver, and his behavior was very erratic, very different, and I couldn't understand. His personality was changed, and I didn't understand what was going on until I realized, when I was diagnosed with a brain injury, when I realized what it was, that I could recognize the symptoms in him. And I said, families need to know about this, because we just about didn't make it. Why are we here? To help raise awareness about concussions and traumatic brain injuries, to help you understand how easily these injuries happen and how prevalent they are, to help you understand the healing processes for concussion and traumatic brain injuries, and to help you recognize that repeated or multiple concussions can lead to serious consequences that may impact your career and your future health. We have a disclaimer here as well. The ideas, suggestions, general principles, and conclusions presented are subject to your personal health and sound medical advice. Every possibility is not presented, nor do we presume all possibilities relate to your situation. This awareness group is not a substitute for recognized medical advice or treatment. Always consult your healthcare practitioner for medical advice. We have group guidelines as well I'd like to review. Is confidentiality. Thoughts, feelings, experiences shared in this group will stay in this group. Respect others' right to keep their information private. Accept and respect what is unique to each attendee in the group. Be respectful of other spirituality, religion, and belief systems. Allow others equal time for sharing. If you prefer to remain silent and pass on sharing at any time, please feel free to do so. And if anyone has any of those nasty little cell phones, could you please put them on? And of course, our meeting structure, we'll have a 20-minute presentation, and we'll cover different topics with each meeting in a progressive manner, from basics of concussion to complications of multiple concussions and coping strategies, resources, and various therapies, and we'll kind of go down along throughout our meeting, so it's not just the same thing all the time. We'll be learning more things every meeting. We'll also schedule in a 10-minute quiet time for those who are fairly high symptomatic. We did feedback group in our meeting in May, and there were a couple people who have requested this because they're so high symptomatic. It's very hard for them to sit here for an hour and a half and listen and stuff like that, so they do need that 10-minute break. And like I said, I'm still recovering from a strobe light incident in July, so I'm going to need that break myself. And then after the break, we'll have another 20-minute presentation. Sometimes we'll bring in a guest speaker. On November 30th, we have a vision therapist optometrist coming in to have a chat with us. And then we'll follow up with a 30 to 40-minute sharing circle. If we need another 10-minute brain break before that, let me know and we can fit that in for you. So now we'll begin with our main presentation for this evening, consequences of multiple concussions. And basically this is what the diagram I have come up to try and explain all the different terminologies out there, which Heather and I have so much fun discussing this. So my way of keeping this simple and clean for most people who are new to understanding all this, concussion is part of the traumatic brain injury continuum. Under there, you also have post-concussion syndrome, persistent post-concussion syndrome, second impact syndrome, and CTE. If you watch the video on my first session last September, you will learn more about all those sessions, so you can go back and review that video if you want. So this is where we don't want to get after you've had multiple concussions, which is what happened to me. This was my fourth one, totally unaware I had 3 prior concussions. And that's where I got into trouble, and I was diagnosed by a neuropsych assessment at Foothills Hospital as mild traumatic brain injury. You also have moderate and severe. I was mild, borderline moderate, and I'm 16 years post-injury. It's going to be with me for life. I'm fairly high functioning. I'm probably about 90% recovered from what I was before, and it'll never be 100%, which is a miracle because when I first was injured, I was probably about 25% operating, a level. I could hardly talk, I couldn't walk, I was so dizzy, I couldn't even keep my head up. And so I've come a long, long, long way. And there was another lady that was asking, how do the doctors come up with these different categories, mild, moderate, and severe? And so this is the Glasgow Coma scale. It was developed by researchers in Scotland in 1974, I believe it was. And so when you first are if you have an accident and you're admitted to the hospital and say you're unconscious, well, the doctors do this little test on you, and depending on how you respond, they give you points, and then they determine if you're mild, moderate, or severe traumatic brain injury. Now, a lot of us don't make it to the hospital. We don't even realize we've had multiple concussions, and all of a sudden you're really in trouble and you can't figure out what's going on. Then it would be the neuropsychologist. Hopefully you get to see one eventually somewhere along the line, and they'll put you through a full or half day of testing, and then he'll deem if it's mild, moderate, or severe traumatic brain injury. It's not a immediate thing. It takes months and months and months to get there. I was 2 years post-injury by the time I got mine done. Statistics for undiagnosed MTBI, the majority of research only reflects about 20 to 22% of the total brain injury population, and basically those who sought hospital treatment. It does not account for those discharged from emergency rooms without being admitted, who visited outpatient clinics, or who received no treatment at all. Hello, welcome. That's okay, find a seat. An incredible 80% of these injuries remain undiagnosed simply because hospitalization did not occur. It happened to me, happened to my husband. We didn't know these were concussions. We didn't know after so many concussions you're going to be in trouble. We didn't know. None of this was hospitalized or documented.
Wouldn't you think that the hospitals and the physicians need to know?
My husband was rear-ended by a drunk driver in the early 90s. He did go to emergency, and they asked if he wanted an x-ray, and he said no because he felt fine. But it wasn't until like a couple of weeks later he got into trouble, and he never went back.
Yeah.
And that's what a lot of people do. They just get up, brush themselves off, and get on with their life. They don't realize that these symptoms that might be coming up 2 or 3 weeks later after that injury are actually related to that injury. And we discussed that in the meeting last week about the cascade of chemicals and that. So explains what happens there. So a lot of people, because the awareness of concussions isn't really that prevalent out there, people don't realize, oh, that dazed feeling I had there, and this bump on my head, and the blurry vision, sensitivity to light, and the balance issue, oh, that's all concussion. I had no idea. It is estimated that in the U.S., 3.5 million people are living with traumatic brain injury. But there's a brain researcher from Mount Sinai Hospital in New York, and there's a YouTube video on him if you want to go have a look at that. He estimates the numbers more in the area of 21 million. So taking that into consideration, in Canada, research estimates there is 1.5 million people living with traumatic brain injury, but based on his numbers, it's probably more like 7 million people in Canada. 1 in 10 people will know someone who will suffer a brain injury this year. It can happen to anyone, anytime, anywhere. It's not to scare you, it's just to make you aware of this, that we have a major design flaw. Our brain is bouncing around inside the skull. This is also another great slide I use a lot. We hear about the prevalence of breast cancer, MS, HIV, spinal cord injury. We hear about the ravages of all that constantly in the news. We never hear about traumatic brain injury. The prevalence of that is more than all those major disease illnesses put together. Why do we never hear about this?
Because the doctors don't know about it.
I don't know why we don't hear about this. That's why I like to be vocal about it, and I encourage all of you. There's some people on the Facebook group that, well, I don't even like to talk to my family about it. They don't understand. They just laugh at me. It's important to become vocal and to explain people and bring family members to these meetings so that they understand. How many is too many? We did discuss this last meeting, but I wanted to include it here as well too. There's no definitive answer as to how many is too many. It appears that individuals with a history of 3 or more concussions may be at potentially increased risk for recurrent concussion, lengthier recovery time, and potentially even long risk terms later in life. And that's what we're going to be talking about here today. The effects of multiple concussions. After third or fourth concussion, the hard cold truth is, in my opinion, you are in trouble. No, you're not in trouble for being late. Find a seat. Each repeated injury becomes progressively worse. You'll experience more symptoms. Symptoms will become more intense, and you'll have longer recovery time. And these are the various symptoms that you're going to be experiencing. These are very similar to concussion, but when you have multiple concussions, you start getting many, many, many more. So you'll just be amazed at what you could be dealing with. And I pretty well had all of these, but I didn't have nausea and seizure, but I had pretty well all of these. So like my doctor said, I was a textbook case. Sensitivity to light noise, constant ringing in ears, constant head pain. This is 24/7, all at the same time, never a break. Shooting head pains, they used to come and go like lightning, literally practically knock me on my ass, whatever I was doing at the time. It was really scary. Migraines, loss of smell or hypersensitive smell. I had hypersensitive smell, especially to perfumes, laundry products, certain hair products, and that. It wasn't the smell that bothered me, it was the chemical combination in there, and it just literally floored me. And it shut me down to the point if I was exposed to it for a long time, I couldn't see, I couldn't talk, my ears were ringing, my balance was off, and it got really bad. I couldn't even lift up my left arm. Sleep issues. Do I need to say more? We're all experiencing that. Problems with emotions. This is what they call emotional lability. That means it's almost like you have no control over your emotions anymore because your brain is not firing properly, and it's just like 1 minute you're happy, maybe the next minute you're sad, and then there's a lot of people who have sudden rage that they can't control. Inappropriate social behavior. A lot of times it's called inhibition. And so a lot of times you don't know what to say, when it's the right time to say something, or you say something that's inappropriate. And maybe you weren't like that before, but now all of a sudden you're dealing with that. Attention and concentration issues was a huge issue for me, and I didn't recognize it myself. It wasn't until I had the testing on the neuropsych assessment, and they showed me the areas where I was having trouble, and I go, oh man, you don't recognize these things. You're just dealing with the day-to-day and the physical things. And this is why driving is not advisable.
You say driving?
Driving. You should not be driving once you've been diagnosed with a concussion, in my opinion, with a concussion, especially with the TBI, until you've been adequately tested by a cognitive driving instructor. And CAR program in here, they cover that. I just found that out. Short-term memory issues. I have great long-term memory. It's just amazing what I remember from my childhood, even the floor plans of all the houses and apartments we lived in my whole lifetime. But you tell me something like yesterday, and then I'll go, oh yeah, did we talk about that yesterday? I have no idea, was that you? So it's just like the short-term memory, like my boss would tell me something, and I go, yeah, I got all that, and I have an armful of stuff like that, and I head back to my desk and I go, shit, what was that he said? It's gone. Like 10 steps from his desk to my desk, it was gone. Post-injury amnesia, a lot of people get this. Sometimes they've had an injury that's so severe that they don't even remember anything about that accident. A lot of people lose a group of years before or after that accident. They've just lost that whole chunk of memory. Metabolic and hormone imbalances. We'll go into that a little bit later. It's the thyroid and the pituitary glands that are most at risk with the TBI. Vomiting or nausea, balance and dizziness issues. Spatial difficulties, that's when you can't manage, you don't know where your body is in space anymore. It's almost like you can't even walk through your living room without bumping into something. It's almost like you don't know how to orientate your arms, your limbs, your body. And I have a big bruise here from the other day. I don't know what it was I bumped into. It still happens. And it just becomes a way of life with this injury. Lack of coordination also works with that, spatial difficulties. Speech problems. I started stuttering and stammering, and I never stuttered and stammered a day in my life, but for many years after the brain injury I did. Numbness or weakness of limbs. This is very scary, but yeah, it has happened to me. My whole left side was numb and heavy and weak. It's like my left leg was like dragging a log behind me. And when I have relapses or very upsetting times and it pushes me back again, I have to deal with all that again. Sexual dysfunction, basically a lot of survivors are saying there's no sex drive at all anymore. Just consider yourself menopausal. Seizures, isolation is a big thing with this injury because a lot of people don't understand it because awareness is not high for concussions or brain injuries, and people don't know how to handle you. They don't know how to talk to you. They don't even know how to give you a get well card. And a lot of people end up with depression and anxiety because of everything that's going on. Well, and this is one of the things we talk about, that TBI has been misdiagnosed in a lot of cases as depression and anxiety. And it's not that. You have depression and anxiety because of the brain injury. Effects of multiple concussions. If recovery was 1 to 2 days or to 1 to 3 weeks for prior concussions, now it could be more like 2 to 3 months, possibly 2 to 3 years or more. So you have to be prepared for that reality. Everybody's different. You could be a miracle case and be better in a few months, but chances are it may be a couple of years. Very real possibility, it may be lifelong. 100% recovery is not to be expected. And this is when I first started researching this, and I said, well, what do they mean by that? Well, I'm going to prove them wrong. I'm going to work real hard, and I tried and I couldn't. I tried so hard. And so I'm fairly liberal saying I'm 90% recovered. I know I'll never get back to that 100, but then I have setbacks where I'm down again to 70 or 60 and I have to build back up again. It now becomes more finding a new normal. And this is I'm going to do a session on this later, just on that itself. Recovery aspects for TBI, it's not a straightforward road to recovery. There's many ins and outs and detours and, oh, this didn't work, so we'll go over here and try that, or, oh, you know, I did really good on this, and then you have a relapse and you go, oh, now I got to start back up again, and it's never straightforward. And this is the other recovery aspects, is everybody has their expectation. You go from here to here, and reality is it's all over the place. It's not a straight line for recovery. It's not like a broken arm, 6 weeks you're better and you get on with life. This is your brain, this is a major organ, this is your motherboard that affects everything that your body is doing. And it can heal itself, but it takes a long time, and it's always vulnerable after that. Who are affected by brain injury? Brain injury affects not only the injured person, but everyone around them. Family roles are changed, careers are altered or threatened. There could be financial difficulties because of that, a downward spiral, depression and suicide. Now, it does not have to happen that way. If you have good family support, and if you get an accurate diagnosis and get proper rehab, it doesn't have to be this downward spiral. TBI rarely shows up on CT scan or MRI. Imaging will show brain bleeds or tumors, which are structural issues. It is the behavioral aspects that help provide an accurate diagnosis. And basically, we are looking at a neuropsychological assessment. And this should always be followed with rehab program based on your testing results, so you can learn the proper compensatory strategies to deal with the deficits of your specific brain injury. Because every brain injury is different. And every brain is different. Every personality is different. So there's always something different. So this, when they did mine, he said, okay, this here is a problem, this here is a problem, this here is great, no problem at all, and this here is a problem. So these are all on your left brain. So most of the damage was on your left, and that hit me hard because I'm a left brain female. Apparently I'm a rare animal. So these are other diagnosis tests that we can do, and I didn't have time to investigate to see if these are available in Calgary. I know this here is the qualitative EEG. It's a service you have to pay for. And I don't know about the other ones. I did do a bit of Googling, and they are available at the University of Calgary, but that's more for research. I don't know if it's available yet for public use, so ask your family doctor. So we're going to be getting into these individually. QEEG is a quantitative EEG brain mapping. It's a method of analyzing the electrical activity of the brain to derive quantitative patterns that may correspond to diagnostic information and or cognitive deficits, and that's what we're after, because that's where you're having trouble operating. And this is what a QEEG brain mapping looks like. So they do the the beta, high gamma, alpha, and they do all the different brain waves, and they do a little test here, because that's your nose and your 2 ears there, so they put this little cap on with little wires and that. And this is something I'm considering doing because of my eye issues, my vision issues. It's been 16 years, I want to see if I can have this dealt with. Okay, TDI, diffusion tensor imaging, can reveal damage due to disease or injury, such as TBI, that hinders the transmission of signals among brain cells. And this is like image of filters in the brain, like a map, and this is basically what it looks like. And then there's also PET scan. I remember coming across this many years. Dr. Ammon down in the States, he's the big expert on this, and he has clinics down there. Of course, he charges people to do that. And again, I'm not familiar if this is available here in Calgary. This is things you got to talk to your family doctor about. And this is what this one looks like. You'll probably never see a lot of these images, but this is what your doctor's looking like. So there's a normal brain, there's a mild cognitive impairment. So there are some changes in there that proves this is your diagnosis, that there is something going on in there.
You can always ask your doctor to see your scans and talk through them with them.
Oh, okay.
So they have them done for...
So I know when I had my MRI done, the clerk actually brought me in, and at the technician, she let me look at it, and I thought it was so great. Because we never get to see it.
And also to print them off so you got a picture of your brain, which is kind of cool.
Oh, that's even better. MTI, it's in the MRI technique. Free water protons, and this is what it's more a high contrast MRI. I guess, again, talk to your doctor and see if this is something that might be suitable for you. SPECT scan, I've come across this a lot as well too. It uses radioactive substance, so I'm not happy about that. For me anyways, I've had radioactive dyes injected into me, and it's taken me a year to recover from that. So everybody's different. And that's what a SPECT scan looks like. So there's a healthy brain, classic post-traumatic stress disorder, and classic TBI. So there are structural issues they can see on here. And this is TBI and PTSD together. And I guess that's supposed to be quite a difficult diagnosis to live with. fMRI is a functional magnetic resonance image. And I've always wanted to have this done when the perfumes were attacking me, to see what parts of my brain were lighting up so they could figure out how to shut it off. But I never found how this got done or anything like that. But basically this is the scans, what it looks like. So different areas of your brain light up depending on different things. I guess you're in the MRI machine, they get you doing different things, and then your brain scan shows up what lights up or whatever. So when you have problems like me with my vision, that might be a way for them to pinpoint how they can get in there or what they could offer to help me. This is something important to be aware as well too, that TBIs are often misdiagnosed as mental illness, depression, or anxiety. If you start hearing these labels and you know you're dealing with concussion and TBI, do not be happy with that diagnosis. Push with that doctor or find another doctor. Chronic fatigue syndrome, a lot of people with TBIs have been diagnosed with that, and it's a shame because they're going down the wrong road. Learning disabilities, well, many children are dealing with traumatic brain injuries, but they've been diagnosed as learning disabled. Hypoglycemia, even menopause, I've had that one thrown at me. So that's why it's very important that you are coming here and you're educating yourself and your family about the symptoms of concussion. You're educating yourself about the different severities of TBI, and you're educating yourself about various diagnosis techniques available. See, that 10-minute period is going to be coming up for me here. Provide accurate reporting to your medical professionals. So I think what happens is that most people go into the doctor and say, oh, I've been having these really bad headaches, and that's all they talk about. They're not talking about the sensitivity to like the ringing in the ears, their balance issues, their speaking problems, or anything like that. They're just concentrating on one symptom. And that's that problem that Linda and I were talking about. Sometimes you go into the doctor's office and they only let you talk to one or two things, and then you're only there for 10 minutes.
That's the new medicine.
So how you got to get through? So write it down.
Yeah, make a list.
Make a list.
So you don't forget.
Yeah. I kept doing that too at the beginning when I was first injured, before I knew any of all this kind of stuff, and I kept forget to tell them about the head pain. I'm living with it 24/7, constant, and I forgot to mention it. Like 3-4 times I went to see him. Forgot. Be prepared to fight for an accurate diagnosis and for the medical attention you need. That's what I mentioned. If you hear these other misdiagnoses and you're pretty darn sure you're dealing with multiple concussions and TBI, don't listen to this, whatever they're saying, that you got, oh, it's a migraine, oh, it's menopause. Fight. and get the right diagnosis and the right doctor. Ensure your testing and diagnosis are followed with rehab so you can learn better coping skills. They call it compensatory strategies. So you have to learn tricks to do things that your brain can no longer do, and only the testing will show that. You need that neuropsych testing, and it'll show you where your deficits are, where you're having trouble functioning, and then they'll build a rehab program to teach you all that kind of stuff. And it's not easy. It seems easy, but it's not. Like they told me, do lists. I'm not going to do lists. But I started diarizing everything I worked on every day. The time, the date, location, everything. I wrote it all down. And I did that for many years. It is so important to ensure you receive rehab after obtaining an accurate diagnosis to help you better understand the specifics of your brain injury and to help you learn better coping skills, compensatory strategies. Although this is Dr. John Cassidy, and he wrote this book, Mindstorms. Although rehabilitation treatment varies from person to person, recovery depends on both the type and severity of brain injury, as well as the brain's ability to heal, adapt, and compensate for residual deficits that may last a lifetime. Time for a break. So anyone who would like to stay out, we'll get right into this. We're not going to waste any time. These are the list of potential problems that could be coming up later in life. And I'm not saying next year or the year after. As we get older, our brain deteriorates differently now because we had these injuries. And a lot of research is showing that there are connections now to some of these major illnesses and diseases that we've been hearing about to traumatic brain injuries. The biggest thing, and I've had several of them, and like the recovery says, it's not from point A to point B, it's like all over the place, and this is what happens. We have relapses and setbacks. When you go through extreme stressful periods, like selling a house and moving, packing and all that kind of stuff, you're going to find that you're going to relapse a little bit. Your symptoms could be full-blown. I had a move where it hit me so hard I couldn't even talk afterwards, could barely open up a door, and I needed 2 weeks off work after that. Subsequent brain injuries, of course, you have to be aware of that, and especially like with concussions, once you've had one, it's so easy to get 2, 3, or 4 more because a lot of people aren't aware they've had that first concussion, or they don't take it seriously enough and they don't slow down, and they're just out there doing all their normal things and they're re-injuring themselves so easily because they don't realize that their vision could be off, their reaction time is off, their judgment is off, their spatial feeling in their environment is all off, and this is why they keep getting re-injured so easily. Decreased tolerance for drugs and alcohol. We talked about this in other sessions. This could lead, when people self-medicate with drugs and alcohol, they tend to get deepens their depression and leads to suicide. So it's never a good idea. Actually, alcohol should be avoided completely after you've had a few concussions. It's not your friend anymore. The brain just can't tolerate it. It's too sensitive now to this. Damage to the brain influences the excitatory or depressing effects of alcohol and drugs. If alcohol makes you depressed following a brain injury, it may make you almost suicidal. Again, from John Cassidy, doctor down in the States. Sensitivity to anesthetic and other medical procedures. Like I mentioned, I had radioactive dye injected into me for a CT scan for another health issue years ago, and I was weak all over. It took me a year to recuperate from that. And same as anesthesiology, I've had some surgeries, and it takes me a good 3 or 4 days. Like my left side just shuts right down. So I'm walking around on a walker and a wheelchair and trying to build up. And I have a kidney transplant coming up in the next foreseeable future, and I'm going to have to be dealing with that. I'm not happy about it, but endocrine problems, like we mentioned, the thyroid and pituitary. These are simple blood work I believe your family doctor can do for you to determine, to wipe that out of your concern if you have other issues. My husband had a thyroid issue that wasn't diagnosed until 1998, and now we look back and backtrack at things. He was rear-ended by that drunk driver in the early 90s. And so now it was a thyroid issue, which we weren't aware of. So once he got that diagnosed by a blood test and take the little pill every day, he was fine. But this is all, it can be related to the brain injury. Head injury is accompanied by tremendous electrocardiographic changes, depression of thyroid function, and hypoxia, decreased oxygen levels in organs. In addition, there is an outpouring of other neurotransmitters, neuropeptides, and hormones. Further studies report that approximately 20% of all individuals who suffer from a moderate to severe traumatic brain injury have a growth hormone deficiency. In particular, pituitary dysfunction as a result of traumatic brain injury has been documented in approximately 30 to 40% of patients. Doesn't mean everybody's going to get it, it's just you have a higher propensity. And clinical observations suggest that the degree of pituitary dysfunction is not related to severity of brain injury, that hypothalamic or pituitary injury could occur even after MTBI that did not require hospitalization. So if it's something that you suspect, get the blood work done. Talk to your doctor about it. Seizure, the epilepsy. There are a lot of people now who, since TBI, do get seizures, and there are medications that you can take for that. The strobe lights really affect me, and I have near seizure events, but it's just something I've never had to deal with before, and now it's just, what do you do? Just avoid it as much as possible. Chronic pain, sleep disorders, stress-related illnesses. Because we're under so much stress when we're living with a TBI, and especially if you're not properly diagnosed, and especially if you haven't had the rehab, and you don't know the compensatory strategies to learn to live with this, you're going to be under a lot of stress. And the cortisol levels are going to be so high in your blood. And that's why the aging, brain injury may be called instant aging. Not only did our injuries move us into the fast lane as far as normal oxidative processes that occur as we age, but we lost brain tissues as well. That's Carolyn Dolan. She's a brain injury survivor, and she wrote a couple books out there too. It's kind of interesting. And so that's where the osteoporosis and osteopenia come into play, because of the cortisol as well in our blood system, because you're under stress all the time, that fight or flight system, and that's no way to live, and you're weakening your whole body when that happens, and the cortisol is the main one that thins your bones. Autoimmune issues. Now I'm the extreme example of that, like my doctor says, casebook study here. I had autoimmune issues when I was younger, and I thought they were fine. And when this all happened with me, and I strived for 7 years before I got to a point where I said, okay, I can get on with this, because I was working full-time every day trying to get on with my life, but it was a battle. And the arthritis is what I had back then, rheumatoid arthritis. When I was 19, I was hospitalized, and I was terrified that was going to come back. And after 5, 6, 7 years fighting with the brain injury, the doctor said, well, your immune system must be fairly strong because it hasn't happened. So I was fine. Then in 2013, so that's 12 years post-injury, my kidneys failed because of an autoimmune response to a virus. So because of the stress of living and working with a TBI for 16 years, working a job that had no job security and had to be renewed annually. It was the stress that brought up this. So it's something you really have to be aware of and protect yourself against, because you don't want to be living with major illnesses happening. There's also neurodegenerative dementias like Alzheimer's and Parkinson's disease. There are becoming more research into this, and there is a high prevalence of these injuries coming at you as you get older because you've had a TBI. Here are the risk factors for Alzheimer's disease, or age, high blood pressure, high cholesterol, heart disease, stroke, diabetes, depression, thyroid disease, heavy smoking, alcoholism, psychosocial inactivity, physical inactivity, head injury, and a family history of AD. Although less than 1% of Alzheimer's cases are the true familiar type, and I got that right off the Alzheimer's website in the US. Also ALS, Lou Gehrig's disease, everyone's heard about that one. Recent studies indicate repeated concussions may contribute to the development of symptoms that mimic ALS. These studies found distinctive protein abnormalities in the brains and spinal cords of athletes who were motor impaired brain injured victims. That means they had trouble coordinating their arms and limbs, so depending on what part of the brain was involved. These proteins are very similar to those found with ALS diagnosis. Other articles indicate Lou Gehrig himself sustained multiple concussions during his career, and his premature death from ALS, which slowly destroys muscles and usually leads to death by respiratory failure, may have been caused by 6 serious head injuries he sustained during his Hall of Fame career. It's amazing as research develops over the years. Discrimination is a big one. This is again Carolyn Dolan, and the brain damaged or brain injury survivor label does not usually create respect. Now you're going to find this most importantly maybe with family members. They don't know enough about what TBI is. They're going to laugh at you and say, just shake it off. For Christ's sakes, it couldn't be that bad. You weren't in the hospital. But where you find the biggest discrimination will be in the workplace. Trying to keep your job if you're still working. If they know about that injury, they're always going to be blaming that and saying, well, you're not good at your job anymore because that's happening. Or if you start a new job, it's up to you if you disclose it or not. There's a lot of HR moral values involved here. I never disclosed it in a new job I had after that contract ended, and I operated fine. There's no perfume in that environment. I actually thrived. But then when I had a strobe light incident, probably 2014, I thought it was 2015, but 2014, a strobe light incident happened at Health Science Center, and she couldn't understand why I was not functioning my normal star self. So I had to explain to her that I have a brain injury and this is what happens sometimes when we have relapse, and it was hard for her to accept that. Can you protect yourself from potential problems in later life? There are always options. The first thing is awareness, getting the correct diagnosis, and receiving rehab. So you learn how to live with this and not be subjected to all your deficits all the time and not be under all that stress all the time. You also should understand the gut-brain connection. There's a book coming up later. I just got it from Amazon, and that explains it. I went to a session too at Community Natural Foods, and there was a neuroscience there talking about this. Very interesting, so start Googling, looking into that for yourself. There's a lot of dietary choices we can make. All this is covered in chapter 7 of my book. If you want more detail, it's in there. You can either buy the book or you can get it at the library. Steer away from all highly processed foods. Switch to more plant-based diet. Avoid fried foods altogether. Avoid all sources of caffeine. Avoid white sugar, high fructose corn syrup, and all disguised sugar names like fructose, dextrose, and sucrose. Avoid all artificial sweeteners like aspartame, pure brain poison. Asparite is a hidden name for aspartame. Equal, NutraSweet, Saccharin, Splenda, Sucralose, Sweet and Low. Those are not allowed in your house anymore. Stevia is a natural plant product, it's an excellent choice. Honey as well is another good one. Buy organic produce whenever possible to reduce lingering poisonous pesticides, because that's just all pure brain poison. And if you're not familiar yet, look into this, the Dirty Dozen. If you can't afford to buy everything organic, who can? Start concentrating on these 3 worst ones here. So never buy apple, celery, or strawberries unless they are organic. And their Environmental Working Group is another great organization, and this Food News org is another good one as well too. So if you want to get away from all the heavy pesticide ones, concentrate on those Dirty Dozens and try and get them organic as much as possible. Eliminate neurotoxins from your home. That includes cleaning products, pesticides, and herbicides. No more of those chemical products with the fancy fragrances and all the chemicals in there. Go for more of the plant-based natural products. You can even make your own with Castile soap and essential oils. Personal care products, of course, is a major issue. Perfumes, colognes, body sprays, air freshener products, pure poison, not allowed in your life anymore. Be aware of occupations where you're exposed to high levels of environmental toxins such as lead and manganese. I forget, they're listed in the book, but one of them was hairdresser, I believe, and another one was welder, and another one was the ceramics industry. And my husband worked in the ceramics industry for a few years, pouring the slip. It's the, when they put in the kiln, they're baking it in there, and it off-gases, all those chemicals come out. Be aware of chemical off-gassing of all building and decorating materials. Are you aware what off-gassing is? You buy a piece of furniture and you assemble it, and it's put together with fake glue, and formaldehyde is in there, and all kinds of things, and this fake wood, and it off-gasses. When it comes out of the packaging, it's sitting in your home environment. You're breathing all that in for the next few months. My husband bought this big cabinet, I won't mention the store, and he's putting it together. It was to store videos. And he had this really bad headache for about 3 days, and he kept complaining. And I said, well, did you ever stop to think it's that cabinet you just put in there? And he's sleeping in the same room. No. I said, well, open up all the windows and come on, let's go for a walk and see if that helps. And it did. So all we did was turn a fan on and blow all that toxic gas out the window, because we had no alternative to move it anywhere. We were in an apartment. He had to stay there. So it's probably better off to buy used if you can, maybe. Avoid and replace all products containing aluminum, including antiperspirants. No more. Avoid and replace all products and environments containing lead, especially people who like to what do they call that? Old homes, because they have all the lead paint in there and all that kind of stuff. You have to be very, very careful about that. Even some of those shopping bags, there was an article on that. I think it was the yellow inks were really bad. They wear off and they flake off, and there's lead in there. So wash those quite often, or switch to ones that don't have all this fancy paint on it. Beware and remove all black mold in your living environment. We hear that a lot, so you have to be very careful and be aware of that. Avoid products or items containing bisphenol A, and so that's a big thing as well now too. Any plastic bottles you get, it says BPA free. So make sure when you are buying anything plastic, I would prefer not to buy anything plastic, but when you do, make sure it is labeled BPA free. Eliminate toxic habits like tobacco, alcohol, and recreational drugs. They're no longer part of your life. If you want to make strides in your brain health and give your brain the best possible advantage, this is this kind of things you're going to have to be looking at. Change toxic behaviors. That means anger, just anything like that. You should be calm and cool and relaxed. This is why the meditation is important. Mindfulness meditations is very important. It's a new way of living. So if you're behind the wheel, you can't be doing that anymore. And if you're the person that gets mad because your neighbor's dog crapped on your lawn, you can't get mad anymore. Just find a more intelligent way of dealing with it. That's your personality, that's your go-to. You have to change that. It's not good for your health. Keep it as active as possible. Keep your brain well oxygenated. Keep your brain well hydrated, preferably with filtered water. And I'm not talking Brita. Brita's crap as far as I'm concerned. You need a filtration system on your faucet or under your counter. Adapt a lifelong learning attitude. You cannot become complacent about this, so you have to go through the diagnosis and the rehab and learning your strategies and that, but keep learning. I still am attracted to anything brain related, and I'm picking up all these books and any magazine articles, anything I come across online. You're constantly educating yourself. There's new research coming up all the time, and it's good to keep on top of that. And it's good for your brain too to keep it active. Seek out a variety of brain training exercises, and I don't mean just that one that's online that everybody talks about, Luminosity. There's hundreds out there. Do different kinds. I have a little Nintendo DS that has Brain Age software on that, and I have Brain Age 2, and there's Sudoku in there as well too. And I did Scrabble. They have a Scrabble that you put on your laptop, and so you can probably download it nowadays. When I had it, it was a disc I bought and installed it. Monopoly as well. I played that on the computer. Words with Friend, I have 5 games going right now with people all across Canada. So never stop. You always have to be doing this kind of stuff all the time. And also for brain training, things that you can do with your hands, like knitting, crocheting, painting, carpentry work, gardening, anything you can do with your hands, the hand-eye coordination, very good. And anything you can do with the cross hemispheres of your brain is good too, like dancing,
Jigsaw puzzles.
Tai Chi. What's that?
Jigsaw puzzles.
Oh yeah, that's a good. I actually bought one at Christmas time. I haven't done it yet.
So good for the
Yeah,
brain.
exactly.
What was that?
Jigsaw puzzles.
Oh, jigsaw
Yeah, crossword puzzles, Sudoku, all that kind of stuff. I went for vision therapy and they gave me mazes to do, and these were big, complicated ones. Oh, I loved doing mazes when I was a little girl. So I sat down. She said, "Just do one a week. Say how you do." Oh, I did 3 in one evening. And she couldn't believe it. Really? And I said, I love doing mazes. So it's just a way of keeping your brain active all the time and doing things. And also seek out a variety of social activities. So it's a good thing. Dancing, you're getting both 2 things right there. You're training your brain and you're doing a social thing. Tai Chi is really good as well too. You're going to a yoga group is really good. anything where you get together with a group of people, and like even this is really good, and you get to socialize with people who are dealing with the same kind of thing you are. If you stay in your home all the time and stay in your house all the time and don't go out, you're not going to meet other people who are dealing with you. Even on Facebook, there are tons of concussion groups on Facebook, and you can chat with people there and you find out, hey, you just live over in the next province from me. So it's kind of nice. Now what? Okay, you also have to slow down your pace in life, and this is hard for a lot of people because they have so many obligations and they don't know how to say the word no. But for your health, for the sake of your brain health and your general health, who are you? I don't need you. Sorry, it wants to be charged up. There we go. So you have to slow down your pace your pace in life. That basically means making decisions and prioritizing what's really important and what's not important. If you have to go to the doctor's office, or go to work, that's more important than being on the phone talking to somebody for an hour or 2 hours. That's more important than going out and meeting somebody for tea that morning. You have to prioritize all your stuff so you can, we'll talk about that too, so you can save your energy for the more important things in life. No. Learn relaxation techniques is very important. Tai Chi, yoga, guided meditations, mindfulness meditations, walking in nature. These are all new things that if you don't do them already, you need to learn how to do that because you're dealing with so much stress because of your brain injury. You really do have to learn a new way of living to counteract all that stress. So that's relaxation techniques. Lessen your stressors and responsibilities is also another big one. If you led a busy life before and you're go, go, go all the time, you can't be living that way now. You have to make hard decisions here for the better of your brain health. So sit down and talk with family members and decide what is too stressful for you right now and what are too many responsibilities for you right now. Maybe there needs to be a sharing and of responsibilities around the house even, and people can help out while you are healing from your brain injury. Also lessen mindless activities like those video games, those shoot 'em up video games. They're not doing any good to your health at all. If anything, mindless activities are using up your valuable energy that you could be using towards brain healing and towards the real activities that you need to be doing in your life to live. Multitasking is also a myth. If you are doing that or thinking that that's what you are doing, actually you are not doing that. Multitasking is a myth. Our brains are not designed for doing that. You cannot be doing 10 things at once and doing a good job on every single one of those tasks. Again, slow down your pace in life and mindfulness and work on one activity at a time. Is there a cure for brain injury? No, the only cure for brain injury is prevention. How to prevent a brain injury. Wear a seatbelt every time you drive or ride in a motor vehicle. Always buckle your children into a child safety seat or booster seat. Never drive while under the influence of drugs or alcohol. Eliminate habits of distracted driving. Pay attention when you're behind the wheel. Wear a helmet and make sure your children wear helmets. Again, helmets do not prevent concussions, but they will prevent skull fractures if you're in a serious accident. So anytime like riding a bike or a motorcycle, snowmobile or all-terrain vehicle, you should always have a helmet. Playing contact sports, skating, baseball, riding a horse, skiing or snowboarding. Keep firearms stored unloaded in a locked cabinet or safe. Store bullets in a separate secured location. This is because sometimes children do get into things that they shouldn't, and sometimes there have been firearm accidents in the household, and unfortunately it does result in brain injury if somebody gets struck. Again, some very simple things to do around the home to help prevent brain injury. Use a step stool with a grab bar to reach objects on high shelves. Install handrails on stairways. Install window guards to keep children from falling out of windows. Use safety gates at the top and bottom of stairs when young children are around. Remove tripping hazards such as small area rugs and loose electrical cords, very important. Use non-slip mats in the bathroom and on shower floors. Install grab bars next to the toilet and in the tub or shower. Maintain a regular exercise program to improve your strength, your balance, and your coordination. Visit an eye doctor regularly for a vision check to help lower the risk of falling. Ensure the surface on your child's playground is made of shock-absorbing material, rubber, or foam, and ensure hallways and stairways are always well lit. And here's a slide I talked about on our last session. I promised to post it in our presentation this time. Size really does matter. Look at the different sizes of the batteries there on the two people there. The average person on the left there has a battery pack of about 15 hours per day. And the little guy on the right there with the Band-Aid and smaller battery is a brain-injured person, and they have a battery pack of only 4 hours per day. So you really must be aware of how you spend your energy and learn to live within your limitations. Huge task for living successfully with brain injury. And here's something I've come across, and it's very popular in the brain injury world as well as other chronic diseases where energy is an issue. It's called the spoon theory. And this is a chart here that illustrates, generally they say you start out with 12 spoons for the day, and that's how you're going to allocate your energy for the day. And it says you take away 1 spoon if you did not sleep well last night, if you forgot to take your medications, or if you skipped a meal. And take away 4 spoons if you have a cold. So that means if you have a cold, instead of 12 spoons, you're starting out the day with only 8 spoons. So you really have to be mindful of how you're spending your energy. Let's say, for instance, we have 12 spoons to start out with. Now you have to get out of bed, that costs 1 spoon. Get dressed, that costs another spoon. You have to bathe, that's 2 spoons there. We're up to 4 already. You have to style your hair, another 2 spoons. There's 6. You only have 6 spoons left to get through the day. How are you going to spend that? Well, if you have to go to work or school or go to the doctor, that's going to take up 4 spoons. So you're going to have 2 spoons left in the evening. And how are you going to handle that? Let's see what we have choices from. You can take your pills, you can watch TV, you can do some reading, and you can surf the internet. And that would be about it. And that would make up, you've lost your spoons, you used up your spoons for the day, and you have to keep in that limitation. If you push it, you're going to have more symptoms, and you're probably going to have residuals for the next 2 or 3 days afterwards when you do push it. So this is a good way of learning how to work within your limitations and guard that energy of yours. You don't want to end up like that poor puppy on the right there. And there's another comic at the bottom here. Want to do something today? Can't. I did a thing yesterday. So you want to try and avoid those extremes and live within your limited energy. And it can be done. It takes a lot of work. And once you've had a few days in a row of where you've worked within your limitations, you'll be amazed at how well it feels. Now we're into the resources section that we have access to here in Calgary. This is a wonderful program. I just learned about this within the last couple of months. It's called the Community Accessible Rehab Program, CAR. It's a neurological rehab program for adults, and you need a referral from your family doctor to get into this. They have 3 centers. One is at the Peter Lougheed Center. There's another at Sheldon Shamir, and another one at the South Calgary Health Center, so there should be a location convenient to where you live. And they teach you, they have a focus on self-management skills and community reintegration. So the service providers you may have access to here are neuropsychologists, occupational therapists, physiotherapists, psychologists, recreational therapists, social workers, speech language pathologists, therapy assistants. And there is also pre-driving assessments available for clients who have a physical, cognitive, or perceptual disability as a result of a neurological injury. So there's a web address. You can check out what is available there. But really, you just go to your family doctor and say, I want a referral to get into this program. and that'll be a great start for you to learning management skills and how to learn compensatory strategies for dealing with your brain injury. And hopefully a neuropsychologist can do a neuropsych assessment on you as well, and then they can offer you rehab based on those results. Perfect. Thank you. And here's another service I heard about from another concussion organizer in town. It's called the CBI Health Group, and they have psychologists who are experienced in post-concussion therapy who will work with you on a one-on-one basis in a confidential, supportive environment to help you successfully manage or overcome your symptoms. And they have various locations in Calgary: North Hill Mall, McLeod Trail by Chinook Mall, and there's some more coming up on the next slide. So the CBI program works with a standardized concussion evaluation, which may include impact testing, subjective and medical history, SCAT-3 administration, orthopedic assessment, autonomic function assessment, visual screen, vestibular assessment, balance assessment, and cognitive assessment. And there is their website. You can check out information on them, or you can phone the 1-800 number to make an appointment. And this is a paid service. If you do want to access this, you do have to pay for that. And here's some more services that are available to you here in Calgary, and unfortunately these are paid services. Myosymmetries Calgary is a clinic that you can access, and they use computer technology to help you. They offer QEEG there to diagnose brain injury, and they also offer neurofeedback. Dynamic Insight Corp, they are a local source for facilitative disability management, including neurofeedback, and there's their websites there. You can check them out and see if that is something that could help you if you have the funds to pay for that. And you might have heard a few of us mention this. This is functional neurology. There's Dr. James Haxton, and his clinic is down in Heritage Point, and he is a Carrick trained practitioner, and this designation is only held by 27 chiropractors across Canada. And Carrick is he's a Canadian chiropractor down in Atlanta, and he has been working on methods of concussion recovery for the last 20-30 years, and he's developed this great system that is working wonders for a lot of people. And Dr. Carrick was actually the person responsible for helping Sidney Crosby get back on the ice. So a lot of people, you're hearing rave reviews about anything to do with Carrick trained practitioners and functional neurology, so it might be something you want to check out, and there's a website there for Heritage Point Wellness. And here's another program you might have access to. You do need a referral from your family doctor. It's the Calgary Brain Injury program. It's with the Department of Clinical Neurosciences at Foothills, and they do have outpatient services there, but it's changed. This is the one I went through in 2003, but it has changed since then now. So they offer, it's a rehab clinic. They provide assessment and treatment for people with moderate or severe brain injuries. Referrals for interdisciplinary rehabilitation at the CAR program for individuals with acquired brain injury and post-concussion syndrome. And they would provide a referral for that program. And they do have acute concussion education program, which consists of symptom management, advice by telephone to individuals affected by concussion within 3 months of injury. No assessment is provided. Again, you need a referral from your family doctor to access this, and there is their website there for further information. Now we're into support and coping resources. SABIS is the Southern Alberta Brain Injury Society, and it offers adult support programs. You must be an active SABIS client in order to attend their groups. There's their website there for obtaining further information, and you can phone and find out if you have access to their programs. There's also the Association for the Rehabilitation of the Brain Injured, ARBI, and Universal Rehabilitation Service Agency, URSA. You might hear about these a lot. These two organizations are more set up, I believe, for the severe brain injured, but there's their websites there you can check out for further information and see if you might have access to any programs there. And for coping resources for children, there's the Calgary Childhood Complex Concussion Clinic at Alberta Children's Hospital for children up to 18 years old. So there's their phone number. You can contact them and see if your child applies for, apply for any of their programs there. There's the Calgary Brain Injury Program through Alberta Health Services. They have a 2-hour self-management workshop. It's called Coping with Concussion, and there's a phone number there, and you can call up and find out when you can register and how to register for that program. I do encourage everyone to access any of these type of programs, because you never know what other living skills and coping skills you can be picking up at other workshops aside from this group. And there's also some brain injury management resources in Calgary. The Acute Sport Concussion Clinic is at the U of C. This is for brain injuries that are sports related between the ages of 13 to 60 and have occurred within the last 4 weeks. And there's their website there for further information. And this is a business downtown called Ascent Integrative Health Concussion Management, but they do not have access, I believe, to health professionals afterwards. So it's basically learning how to manage and deal and live with a concussion. So they have their phone number there as well too for further information. These are all paid services. They're not paid for by Alberta Health. And this is another management resource we have access to here in Calgary, and you do have to pay for this one. It's not covered by Alberta Health. It's Complete Concussion Management. This is a conglomerate from across Canada. It's originally based in Oakville, Ontario. And we do have 3 clinics that work under this conglomerate. Northern Hills Sport Physiotherapy in the Northeast, Peak Health and Performance on Elbow Drive, and the Athlete Factory Sports Therapy Clinic in the Southeast. And there's their phone numbers there if you wish to access their services and see if that's something that can help you. And for support and coping resources, I highly encourage you to check out the support groups that are available on Facebook. You just go log on to your account and search mode in Facebook. Just start searching for concussion or brain injury, and you'll be amazed at how many groups are in there. Just join one to begin with and see how you go along. You don't have to comment or anything. It's interesting to see other people, their comments and their postings, and see what other people are dealing with. And it's interesting to see, and you do pick up handy tips every now and then of certain programs, like the Insight program I was telling you about, and the Twilight program, the blue light filter that we can download for our Android devices. We also have 3 local meeting groups here in town, in Calgary. Concussion Life. They meet the first Sunday each month down in Kensington. They started the spring of 2017. They have a website there. Concussion Info and Support Group. They are a meetup group, and they meet twice monthly at the downtown Co-op Market, and they started July 2017, and they have a website there as well on the meetup website. And then there's us, Calgary Concussion Awareness and Support, and we meet the last Thursday of each month at the Brentwood Community Center, and we started this group in November 2016. And there's our link to our Facebook group. And here are also some other wonderful, great resources to learn about TBIs. These are some books that I've come across over the years. Over My Head is by Claudia Osborne. She was a doctor, and she got hit by a car while riding a bicycle, and she was a severe brain injury, but still it's very interesting to read what she went through for her rehab and living in New York and trying to get around on the transit system. It was quite interesting. Brain Injury Survival Kit is also written by a Dr. Cheryl Sullivan, and there's a lot of great tips in here. I really like that book, so if you can find it, I believe I did get it at one time through the library, and she is writing from her own experience, from her own injury, as well as dealing with both her parents who have received brain injuries from falls. And the other book I have referenced that a few times in this presentation is Mind Storms by Dr. John Cassidy, and it's a complete guide for families living with traumatic brain injuries. That's a very interesting resource to read and get a handle on what it is like living with this injury. And these are some books that are specifically about mild traumatic brain injury. The first one here is Coping with Concussion and Mild Traumatic Brain Injury by
Diane Stoller. She's a doctor, and she wrote from her experiences as well too. This is the book I first came across in the early 2000s, before I knew I was dealing with mild traumatic brain injury, and it was after reading her book and doing research online that I was convinced that this is what I was dealing with, and I fought for a neuropsych assessment, and the rest is history. Brainlash, this is written by another doctor. She was a psychotherapist, Gail Denton. She's down in Colorado. She's actually the lady who wrote the foreword for my book. And this is her experiences. She was doing inline skating and had a fall, ruptured her spleen. She had to have surgery, and then there was complications, and she received a brain injury from that. And so this is her account of what she went through, and coping strategies as well too. It's very informative, and I found it a very humorous book in certain sections. There's also another book here. I've never come across this one, but it looks quite interesting and informative. It's Understanding Mild Traumatic Brain Injury by Mary Ann Keatley, and I'll have to look and see if that's available in the library, but it looks like a most informative book. You don't come across too many of them that are specifically for MTBI, in the sake that I refer to it as. It's not a concussion, it's a mild traumatic brain injury as a result of multiple concussions or a serious enough accident that gets you into that territory past the red line that we talked about earlier. So these are some good resources for that. And again, some more books about MTBI, The Ghost in My Brain by Clark Elliott. He was a professor at a university. Just astounding to read his story and what he went through to still try and keep working while he was dealing with this concussion. Amazing. Brain Injury Rewiring for Survivors, Carolyn Dolan. I've referred to her a few times in our presentation, and she has this book, Rewiring for Survivors, and I believe she also has another one, Rewiring for Caregivers. So well worth checking out those books. And of course my book, Regaining Consciousness, My Encounter with Mild Brain Injury, The Silent Epidemic. It is available at the Calgary Public Library. So do check that out, and you can learn lots of information in any of these books about living with mild traumatic brain injury. And these are some books on general brain health. Why Is It My Brain Working by Dadis Karzan. And this is a huge book. I don't know how many pages, but it's very heavy, big paperback book. I got this recently from Amazon. It was suggested to me by something else I came across online. And it's not regarding living with brain injuries, it's mostly about general brain health and things that you can be doing to ensuring your brain health. The second one there is Brain Maker by David Perlmutter, and that's about the brain-gut connection. So that's a very good book. I'm just getting into that, and it's another change that we can do for our diet and improving our brain health. So it's something worth looking into. This book is a Canadian researcher, Norman Doidge, The Brain That Changes Itself. Very fascinating to read this about understanding about neuroplasticity and how the brain can heal itself and how it changes by the way you think. And it's a very interesting book, very good reading, so I'd look that one up for sure. And we'll wrap a few things up here now. Closing thoughts. Educate yourself and family about concussions and brain injuries. Recognize the symptoms. Keep a concussion diary for yourself, your children, and other family members, because it could become in handy if they have future injuries. And you go, oh yeah, don't you remember that time, this happened and that happened? And report incidents to your healthcare professionals. So it's adequately documented, so if you do have any future injuries, it is documented there, and they'll take you more seriously when they see you've already had 2 or 3 concussions prior, and now if you go in with the 4th one, you're into serious territory now, and your doctor will take you more serious knowing that you've had prior concussions. And remember, we are carrying precious cargo atop our shoulders. Treat your brain with respect. Your health and life could depend on it. It is possible to lead a fulfilling and productive life in spite of TBI. It takes courage, patience, and persistence, and a lot of support and understanding from family and friends. What is broken will mend. What is hurt will heal. No matter what happens, the sun will rise tomorrow. Keep going. Never give up. And our next meeting will be November the 30th from 7 to 8:30. We will be having a vision therapist, optometrist, coming in and speaking with us. First, I'll have a session where I'll talk generally about the vision issues associated with concussion, and then Dr. Penny will be joining us for the second half of our presentation to explain to you what vision therapy is. And we're also, hopefully in the future, we'll be talking about tools for coping and communication and family experiences. And I'm hoping to bring in some future speakers. A concussion doctor from New York has expressed interest in joining us via video conference, and I'm trying to bring in some family physicians as well who can talk to us to help us understand why is it so hard for us to find the proper help we need. So that is the end of our presentation for this evening. Thank you very much for everyone for joining us, and we look forward to seeing you next month. Take care.